Hi, I am Famida. I have completed my optometry course from Raihan Eye Hospital and done my internship at Dr. Agarwal's Eye Hospital. Now I am working at Lenskart and I am doing fellowship program on Strabismus management in Indian Academy of Optometry. Strabismus is also known as squint. It is the proper alignment of two eyes is disturbed. Squint can be either tropia or phoria. Tropia means the manifest squint and the phoria is latent squint. There are two major types of deviation, committant deviation and incomittant deviation. In committant deviation, the magnitude of deviation is the same in all direction of gaze. In incomittant squints, the magnitude of deviation varies in different gases. This is due to extraocular muscle underaction, which may be a result of muscle restriction or paralysis. The deviation is also classified in terms of direction, that is, iso, exo, and hypo and hyperdeviation. In iso-deviation, the affected eye will be at the nasal side, and in exo-deviation, the affected eye will be at the temporal side. In hypertropia and hypertrophia, it will be either in upward position or in downward position. The examination of any patient with squint begins with thorough history. The history taken is important because it gives the patient to adjust to the surrounding and also provide the opportunity for the examiner to observe the child and the type of ocular deviation. We should ask the question like the age of onset and the history of trauma, the family history, and the obstetric history that the child have any abnormal delivery or like that. We have to also notice the patient have double vision and the squint is either unilateral or bilateral and it is intermittent or constant. Here is my patient Misna. I have taken her history. She has no trauma or family history of strabismus. Now I am going to take her vision. She has normal vision 6/6 in her right eye, and for the left eye she also have 6/6 vision, and she has no abnormal head posture and any other chin elevation, or she does not have anything like that. Now I am going to do the Hirschberg test on her. I asked her to fixate at the torchlight. You have to notice that either the corneal reflex is on the center. She have normal corneal reflex, it's at the center of the cornea. If there any deviations, it will be at the pupil margin or in between the pupil and limbus or on the limbus. If it is at pupil margin, the deviation will be 15 diopter, and at the in between the pupil margin and the limbus it will be 30 diopter, and if it is on the limbus it will be 45 diopter. Now I am going to demonstrate the Bordach examination for her, which here have to notice her ocular motility. I ask her to fixate on the pen and I move towards the 9 gaze positions. While doing Bordach, carefully look any misalignment of the eye and is there any movement of the eye is not smooth or accurate. For her, the movement is normal. And if there any paresis or paralysis, the movement of the eye will be not smooth as normal eye. For example, if the patient has medial rectus palsy, the eye movement towards the nasal side will be not smooth as the normal eye. Now finally I am going to do the cover uncover test on her. We don't have to do the cover test, it only do in the manifest cases of squint. She doesn't have the manifest squint, so I have to find out she has phoria, so I cover and uncover her eyes. Secondly, we have to do the alternate covers test. It will bring out any phoria that is present additional to the tropia. In this test, we have to alternatively occlude and uncover the both eyes. We have to occlude the eye for a few seconds and uncover. We have to notice the direction of the deviation. In the cover test, the one is covered and the movement of uncovered eye is noted. Uncovered eyes move inwards to the fixation. There is exotropia. If the uncovered eye moves outward to take up fixation, there is esotropia. The test is repeated for 33 centimeter, 6 meter and 4 distance. In the alternate cover test, the cover is moved from one eye to another and the movement of uncovered eye is noticed. On a patient, we have firstly done the Hirschberg test, that is normal. The corneal reflex is centered, so she have 0 degree of deviation. Then on the second test, broad edge, her movement was to all the gaze position is normal and her ocular movement is smooth. Then also in the uncovered test, she does not show any phobias, so the result is normal for her. This is my conclusion. Thank you.